Hello. Today we're going to discuss normal fetal heart structures. So we're just picking back up where we left off from the last lesson. And then we're going to do a quick recap on fetal situs. All right. So let's first start with this four-chamber view. So here we have a four-chamber view. You have to be familiar with the normal heart structures. So yes, remember that we have four chambers. Remember that the right ventricle is the most anterior or superior chamber, whereas your left atrium is the most posterior chamber. Okay. Remember the morphological markers for each. So we have the moderator band for the right ventricle, the pulmonary veins for the left atrium. Remember the valves associated with each side, your mitral for your left side, your tricuspid for your right. Your tricuspid valve is slightly higher on the septal wall than the mitral valve. They should not be along the same. They should not be linear. With your interatrial septum, there are three parts. The first being the septum primum. So septum primum is first, septum secundum, which is second, and then foramen, which is here, the hole seen in the center. Remember with the foramen, the blood flows from the right atrium to the left. So that shunt is from right to left. Okay. Let's look at LVOT and RVOT. So with your LVOT view is also known as the five-chamber view. So this is the long axis view of the heart. It is the path from the left ventricle, which you can see here, lead it into the ascending aorta and eventually joining the aortic arch. You can see in the demonstration of the grayscale. With the LVOT view, you want to make sure there's direct continuation of that anterior wall to the ventricular septum. VSDs tend to hide there. So definitely want to see that continuation, which you can see in both demonstrations. Okay. Now with your RVOT view is showing the pathway from the right ventricle. Okay. So we're showing direct communication from the right ventricle leading into your pulmonary artery and then eventually heading towards a bifurcation. Okay, which you can see here. Now with the RVOT, you have your pulmonary artery, and then it bifurcates into the left and right pulmonary arteries. Your pulmonary artery should cross over your LVOT or your ascending aorta. Okay, so that should cross anteriorly over that view. So it should crisscross, no parallel. Okay, now they cross over at about a 70-degree angle. Okay, but they should cross. And the reason why this is important, I have a demonstration of where they do not cross. Notice, you see the right crossing, but notice that the LVOT should be heading towards the fetal left spine, but instead it's heading back in the same direction as the pulmonary artery, and they're running parallel. So this is not normal, and this is a demonstration of transposition of the great arteries. So that's why that crisscross is important to see. Okay. All right. So now let's talk about the three-vessel view and three-vessel trachea view. In your three-vessel view, you have your pulmonary artery, your aorta, and your right SVC. Okay. Coming from left to right, in descending aorta, your pulmonary artery being the largest, your SVC being the smallest. Notice that they are to the trachea's left side and anterior to the spine. Now, eventually, as we keep sweeping, they will converge into a V shape, which you can see demonstrating here. They will join into a V, lead it into the descending aorta. When we look at our color example, both flow in the great vessel should be going in the same direction, which I have an example. Okay. So this is forward flow in both the aorta and pulmonary artery. Now, at the ends of each great vessels, with the aorta, you have your aortic isthmus, and with your pulmonary artery, you have your ductus arteriosus. These will join together, lead it into your descending aorta. Let's take a look here. There, you can see the demonstration there. And then I also want to show you a sweep from my four-chamber view through my LVOT view. You'll see the crossing over of the pulmonary artery, how it should crisscross, and then you see leading into the three-vessel trachea view. See? All right, perfect. Okay. All right, so for your exam, you will need to know the difference between cardiothoracic ratio as well as your thoracic abdominal ratio. Okay, so let's go over the difference here. Okay, now with your cardiothoracic ratio, you're ruling out cardiomegaly and pulmonary hypoplasia. Your normal values is less than 0.5. If it's greater than 0.5, then that is abnormal. That means that there is a suspicion of cardiomegaly. Okay. With your thoracic abdominal ratio, here you're comparing the chest size to the abdomen. So if it's less than 0.7, that indicates that the chest is small. It is abnormal. So know the difference. So thoracic to abdominal, we're comparing the size of the chest to the abdomen. We want values greater than 0.7, but not less than. If it's less than, that shows that it's too small. And just to recap, let's go back to the cardiothoracic ratio. You want values to be less than 0.5. If it's greater than that, then that indicates cardiomegaly. So know the difference between the two. I did have a question on this. Okay. All right. Now we do need to know our heart values. So normal, pretty standard. We know usually it's what, 120 through 160. But keep in mind early on, it could be different. So early on, usually before 7 weeks, heart rates can range in between 100 through 115. Okay, so that's not bradycardia at that time. Now, at 7 to 13 weeks, you can have a range between 120 through 175. And then, of course, after that, 120 through 160. Now, doing bradycardia is usually around your, I guess you can say, starting after 8 weeks, 8 weeks to 40 weeks. Okay. Bradycardia is a sustained heart rate of less than 110 beats per minute. Okay, occasionally, if you're applying too much pressure on the mom's belly, you may see a few dips, but it should go back to a normal rate. So when I say sustain, that's usually more than a minute, more than 2 minutes. Usually I had a first trimester baby who had a sustained heart rate the entire exam at 109. It was there the entire exam, so the entire 30 minutes. So that was known to be bradycardia. Okay. Now tachycardia is a extremely fast heart rate. So that is a sustained heart rate that's over 180 beats. Now, occasionally when baby is breathing or has the hiccups or moving, very hyper at the time, you may see a few accelerations, but sustained mean never goes to normal. It stays above 180 the entire time. Okay, so those are the difference between those. And now let's go back to our fetal situs. So this is just a quick recap to what we had gone over from the last time. I felt like we need to just to go over it one more time, because I feel like you can never go over this too many times. So just to be clear, I go with the clock method. That's my preferred way. It's easy for me to understand. So with the vertex babies, remember, vertex or breech, we are at a longitudinal lie. Okay, so the spines are parallel with mom. And you can see that in an example with the baby's positions here. So just starting with both A and B, the baby is vertex. So you see where the spines are located, parallel to mom. The heart for a vertex baby, head down, is at 5 o'clock, and the stomach is at 3. Okay, you can see that in both examples. Now, breech baby, we're still parallel with mom's spine, but the presentation is different. So then the heart apex is at 7 o'clock, and your stomachs are at 9. Okay, so we're at a longitudinal lie. The fetus spine is parallel with mom's spine. Okay, now I want to go over what those arrows are showing. They're showing that the descending aorta and the apex are indeed on the left side. And this is normal. This is how it should be. So let's look at an example where the descending aorta is on the right side. What is that usually indicated of? Right-sided aortic arch. So with our right-sided aortic arch, you're going to notice that that descending aorta is on the right side instead of the left. Okay, now the best way to diagnose right-sided aortic arch is with your 3-vessel trachea view, but you can also suspect it with this view as well. So I wanted to show you an example. And then, of course, this is an example of normal, because you can see here the descending aorta is on the same side as the heart apex. Okay. All right. So now let's focus in on transverse. I find it's in a clinical setting, it's easy to pinpoint the presentation with our transverse lie versus our parallel lies. But what's important it is for our exam. For our exam, as I mentioned before, they're going to show you pictures of just the heart apex location and the stomach location. And they're going to ask whether the baby's in a longitudinal lie versus a transverse or perpendicular lie. So it's important in that case to know the position of the spine. That's what's going to tell you the difference. And so this slide here is what you need to study for your exam so you can see the difference where the spines lie. So in your longitudinal lie, they're running parallel with the mom spine. You see the spine's locations. Okay. And then, of course, you see heart apex location when the breech versus vertex. In your perpendicular lie, whether the head is on the left side versus the right, whether the spine is up or down, you see where the spines are located for your perpendicular lie. Remember, your perpendicular lie is across. It's creating the T with the mother spine. So it's running across the belly. Okay. All right. So let's just do a quick recap. So let's start with breech. Okay. So we have breech and transverse head maternal left. The heart apex positions are the same. Okay. And we can indeed see that. The hearts are positioned at 7 o'clock. Okay. And then, so then our stomachs will be at 9 o'clock. Transverse head, maternal left, and our breech positions, 9 o'clock. Now in vertex, which you can see here, and transverse head, maternal right, you see there, the hearts are positioned at 5 o'clock. Heart apex is at 5. Your stomachs will be at 3. Okay. But what's important is the spine locations. Clearly, we can see when they're perpendicular, whether it's spine up or spine down. Perpendicular, that's a transverse line across, creating the T. Parallel line, longitudinal line, you see the spine locations. Okay. And last but not least, we have to know pre and postnatal structures. So we're just going to go over it. Just please remember this for your exam, for your test. So umbilical vein will be the round ligament of liver after birth. Umbilical arteries will now be known as the superior vesical arteries. Your ductus venosus, ligamentum venosum. Ductus arteriosus, ligamentum arteriosum. And the foramen ovale is the fossa ovalis. All right, and we are all done. Our next lesson, we will pick up at congenital heart disease part 1. And if the time allows, we will go over, or at least start to go over, congenital heart disease part 2. Until then, have fun studying. You can always email me if you have any questions or concerns at ultraprocert@gmail.com. You can find that email in the link on the top of the YouTube channel. If you have any questions or concerns, please email me, or feedback, you can email me as well. All right, have a great day. Until next time.